And all right, everyone should be trickling in right about now. All right, welcome everyone to the Ready by 5 new contract onboarding session. Many of you have been here before. It will look a little different than what we've done previously, and there will be some new information to offer. So if you have any questions, just feel free to put those in the chat. We'll do a quick introduction here. You can put your name and organization that you're affiliated with in the chat. And any questions that you have, just put those inside of the chat box. And there will be multiple individuals here monitoring that chat so that we can be sure to get to your question timely. We're going to go ahead and introduce ourselves here while you're introducing yourselves in the chat. Katia, you want to kick us off?
Sure. Good morning, everyone. My name is Kathy Cortez, and I am the Vice President of Finance for First Steps Can.
Good morning, everyone. My name is Jasper Tinoco, and I'm the Data Specialist for the Ready by 5 MIllage.
Good morning. I'm Lindsay Bloomers, and I am the Finance and Office Coordinator.
Good morning, everyone. My name is Elise Green, and I'm the Funding Administrator for Ready by 5.
Good morning, I'm Megan Frang. I'm the Communications Director for First Steps Kent.
Hi, everyone. I'm Carter Goldstein. I am the other Funding Administrator at First Steps Kent.
And I am Kiana Zadare. I'm the Program Manager for Ready by 5. Our President, Jennifer Headley Nordman, is not available this morning. She's taking care of some personal matters. So with that, I'm going to go ahead and transition to our introduction for today. Welcome Chair Green, everyone, from the Kent County Commissioner's Office. And he is our board chair. He's just got a quick introduction for everyone here.
Well, good morning, everyone, and thank you for making time to be here this morning, and welcome. I am, as was mentioned, Ben Green. I'm the chair of the Kent County Board of Commissioners. I also am the county commissioner representing the 1st District, which is about half of Plainfield Township and all of Algoma Township. I live in the Northview School District, just across the border from City of Grand Rapids into Plainfield Township. I just wanted to take a few minutes to welcome you guys today. Thank you for your involvement. Obviously, you play a critical role in us achieving the ultimate goals that we look to achieve with Ready by 5. And set our young people up for success later in life, our children, and we appreciate that quite a bit. First Steps Kent sort of serves an administrative role in this whole process. Their role is kind of to carry out the expectations and the vision that is set by Kent County, and that, frankly, the voters set when they've twice approved the Ready by 5 millage on the ballot. So they've bought into what we're trying to do here, and we have the Ready by 5 there to, or First Steps Kent rather, to play the role of achieving those goals and making sure that we hit those expectations. And I think it's really helpful for you guys to know that sort of moving forward and understand that. I know some of you have been here before. We welcome you back. For those of you who are new, we're excited to learn alongside you and work with you. And I'll just say that I am a dad. I have I have one school-age kid, and I have one in kindergarten. My daughter is 5, and my son just turned 18 months last week. So I'm kind of in there with a lot of the folks that our clients are, people that use our services, the people that you guys will be serving. And so I kind of understand that from other people I talk to that are other parents, the importance of these programs from a, kind of hand-to-hand ground level. So it is critical, play a great role, and really invaluable resources for our little people and for their parents too. So I just wanted to, say welcome. we're really glad to have you here as part of our broader Kent County family, and look forward to working with you guys in the months ahead to better serve our young people and our community. So thank you so much.
Thank you, Chair Green, for joining us today. It is a welcome surprise to have our board chair here, and we enjoy working alongside the county to ensure that we administer the millage appropriately and that we meet the constituents' needs ongoing, and all of you are part of that. So how do we make sure that every child enters kindergarten healthy and ready to succeed? With our 3 overarching goals, we ensure that babies are born healthy, that they are thriving and on track, and that they are ready to learn. And we follow the Kent County vision to ensure every child is ready to learn on the day that they enter kindergarten, focused on 0 through 5, not 0 to 5, because up until the day before their 6th birthday, we want to be sure that they're enrolled in services. This includes expecting parents. And we also want to increase the amount of access that they have to resources and information and support their health and well-being along the way to ensure that their children are developmentally on track and that they have a safe home environment free of any environmental concerns. With that, I'd like to go over some of our provider requirements, and I'm going to transition over to Elise, who's going to give a little bit of background.
All right. So what does it look like to be a Ready by 5 service partner? Well, you probably are trying to figure that out. And some of the things are the service provider manual, which includes our program requirements, our financial requirements, reporting, and organizational requirements. And majority of this we will go through today. And if you need a copy of the service provider manual, you can more than likely reach out to Carter or myself. And this information really explains to you what you have to do, how you do it, and how we will support you along the way. One of the things that we do require is a training requirement. There is a care model training series for any newly hired early childhood professionals. If you are a early childhood professional with training hours through other agencies, you can potentially receive a waiver, and you can reach out to your funding administrators for more information regarding that. Another thing that we look for is parent satisfaction. Okay. So all agencies have to have some type of survey where they have information from their parents regarding how are their services, do they enjoy it? And this year we have some updates. All agencies must have a parent survey and reporting findings within their quarterly reports. Your parent surveys may include previously recommended questions. So how are you satisfied, extremely satisfied, those questions, but it's not required. We have a recommended process of distributing an anonymous survey link during or after service is completed. And all agencies must have a minimum response rate of 40%, but the ideal participation is 70%. So we've heard your comments and concerns, and if you have the service parent satisfaction survey within your services, you can use that information. If not, you can continue using the questions that we provided in the past. So now we're going to look at what does the Ready by 5 service provider agreement or the contract look like. So in terms of the Ready by 5 millage, you have exhibits A through F, which is your implementation plan, description of services, your data profile, an updated budget, reporting schedule, deadlines that we provide, and then your service provider proposal and any related communications. So to break it down a little bit more, we'll go over the contract components. So everyone should receive within your SharePoint folder, and if you do not have access to it, please let us, Carter or myself know, and we will get access to you immediately. So you first have your legalese, so your legal boilerplate that is there within your service provider folder, and we just ask that you review it. Then you have exhibits A and B. Exhibits A and B are one Word document. You'll have your implementation timeline, and this is just information on how are you going to reach those goals that you outlined in your proposal or your continuation of funding form throughout the contract year. Next, you have exhibit B, which is description of services. So there we're looking at the number of individuals to be served and number of encounters to be completed. We have your geography and population focus, your positions funded, and your MOUs and agreements, and as well as any updated goals due to the amount of funding you were awarded. Then Exhibit C, which is by itself, is a data profile. There we will update with you through those key metric meetings and share any updates to the data profile regarding what information is required and not required. And Jasper will go in more detail about this later on. Next, you have your budget template. It is an Excel document. You will complete that based off of the funding you were awarded and how you are going to use the funds for your various programming. We will upload the reporting schedule guidelines. This is the document that tells you when your quarterly reports, invoices, as well as data is due, and any changes to deadlines based off of the dates ending on the weekend. And then final is your award letter, your proposal, and any other related communication, which will be Exhibit F, which we will also upload. Once all these documents are completed, we will put it together and send it to you via DocuSign for your final signature. And hopeful goals is to have it all completed by October 1st, which is the beginning of the contract year. And again, if you have any questions, please put it in the chat. So next, I'm going to hand it over to Carter to talk more about those requirements for reporting.
All right, everyone, we're going to talk a little bit about those reporting requirements through the contract period, which begins on October 1st. So many of you have been made aware that we are switching platforms from EC Impact to Submittable. Our new providers will mainly use Submittable. We are going to have our invoices for the last month of the current contracting period, September, submitted in EC Impact, and then we're going to move over to Submittable for everything. All right, so some reporting requirements to make you aware of. Every month, you need to submit your invoice for payment, and we'll go over those dates in just a little bit. And then you also need to submit individual data regarding each child or expectant parent served. So this requires a signed data agreement with First Steps Kent and the Health Department, which you should have individuals complete upon intake to your program. And then the data format must follow our Ready by 5 file definition document as well. So that's due every single month. And then quarterly, we have program-specific outcomes and updates submitted on a quarterly schedule, which we'll share with you all in just a moment. All right, so here is that schedule, and this is going to be in your service provider manual for your reference. And we will, I believe, also just have a document where every single date is listed out exactly when everything is due. So we'll go through this column by column. So right now we have the measurements and updates column, and then we take a look at the invoices. So invoices are submitted, by the 10th of every month. You can see that it says submitted through EC Impact. And again, we will have that final invoice for this contract period submitted through EC Impact. Then we'll move over to Submittable for the next funding years, the upcoming funding years invoices. So for that, we just need the actual expenses and any notes that you have for us funding administrators as we review those invoices. Moving over, you also need to submit your data to the Kent County Health Department each month, and that's going to include your number of individuals served, encounters, and Ready by 5 indicators. Moving over, we also have our quarterly reports. Those are due by the 30th of April, July, October, and January. And again, those will be submitted via Submittable now that we're moving away from EC Impact. So this is going to include your number served, an update on your program-specific outcomes, and then narrative explanation of any variances, any successes, any challenges that you've faced, just really giving us a chance to dive deeper into your program impact, and also just creating a touch base point in case we need to get in touch with you regarding any variances or anything like that. All right, so right now we're kind of moving back a little bit to those different elements of your contracting process. So right now we're in the process of finalizing all of your documents with your assistance so that we can get everything signed and get things underway once the contract period begins. So right now we're working on revising budgets. So you submitted a budget in either your continuation of funding or RFP document. And right now we are working to revise those budgets to ensure that they are aligned with the amount you were awarded and that they are still within the scope of your programming. So right now we need you to complete the budget template, which is in that SharePoint folder. As Elise said, if you're not seeing a certain document in that folder, or if you're having trouble accessing it, please reach out to us and we can help. So the budget template, as we said, it needs to be completed based on the amount that was awarded versus the amount that you requested. So please adjust your budget to fit this awarded amount. If your allocation amount remained the same, you can just make minor edits to that document. That needs to be uploaded to your SharePoint once it's complete, and changes must adhere to the original scope of your proposal. So there cannot be any additional goals or objectives added. It really needs to adhere to that scope that you identified in the RFP or continuation of funding process. And as we've said a couple times now, those contracts begin on October 1st. So just another quick note regarding your budget. Please take a look at your staff position titles and expenses that you've included in the budget. This information is going to be used to finalize our Ready by 5 funded staff position list in the service provider agreement. So you'll need to provide the designation of direct or indirect for each position, the FTE that is funded by Ready by 5, and then a brief description stating how this position supports your program model. And please reach out to us if you have any questions regarding those details. All right, we talked a little bit about these quarterly reports, but just a little bit more detail here. These are going to be submitted via Submittable, which we're working on getting up and running. More details to come on that. This is, again, just kind of a deep dive into where we're at each quarter of your program. So we want to see some program-specific metrics and updates. Please do not include any identifiable data. Again, we are not able to view that. And we will have the service provider agreement to you guys for those deadlines as well. Quarterly reports include performance metrics, program updates, and then storytelling. So we want to see those individuals served with any variance explained, encounters, again, with any variance explained, and then program updates. We want to hear a little bit about how your timeline is going, if things are on track. If anything is off track, just let us know why so that we can be aware of that. We want to see your parent survey rates and feedback. We want to hear a little bit about budget changes, if any of those come up, staff changes, and trainings attended by Ready by 5 funded staff. And then we do really want to hear from you with your individual served permission about any successes that you've had. As we all know, working in this realm, those success stories are really impactful and really are one of the most effective ways that we can show the impact of the programs that you're all delivering. So please be sure to share a success story if you are able. All right, I think with that, I'm going to turn it over to Jasper to tell us a little bit more about data.
Thanks, Carter. So we'll go over data and consent. So we require that families give consent before any identifiable data is shared with the Kent County Health Department. This applies both to the service providers and to subcontractors. The consent language itself covers a few things. It gives permission to send identified data to Kent County Health Department. It explains how and where that information will be used. It also includes consent for referrals if it's applicable. And it also makes clear that families can cancel their consent at any time. The language is standardized by service type, so Play and Learn has its own version, and Home Visiting has another, and that can't be changed. So in short, consent is about making sure families understand exactly how their information is being used, while also keeping our data practices consistent and transparent across all programs. Next would be the privacy notice. So the privacy notice gives families additional details on how their information will be used once consent is given. Explains how long the data may be retained. It also describes how it's stored at the Health County Department, what information is shared with Kent ISD, and how the First Steps Kent receives the de-identified information to report outcomes. The privacy notice is specific for the Ready by 5 data use only, and it does not replace your agency's own privacy or disclosure requirements. Those are still needed to be provided separately. And all these links will be shared with you after the meeting or sometime within. Just reach out if you need anything as well. So next, we're going to go over the data agreements and BAAs. As part of the annual contracting process, each agency signs a data sharing agreement, and there are actually two agreements, one with First Steps Kent and the second one that allows evaluators access. Which agreement you sign depends on your HIPAA status. So if your agency is HIPAA covered, you'll sign the BAA template and amendment. Existing BAAs do remain valid if they're accurate, so make sure you check on that. And if you're not HIPAA covered, then you'll sign the data agreement and the amendment. The important thing to know is that we'll provide you the templates during contracting, so you won't have to figure it out on your own. These agreements simply lay out how your data will be shared with the Health Department, First Steps Kent, and the basis research evaluators. Some programs and services, such as the fetal infant mortality review, the training and education and translation and interpretation services, are exempt from these agreements. So next we'll get over to the monthly data submissions. A lot of this was kind of relayed in the previous slides, but each month your program will submit 3 files, those being the demographics, the services, and the referrals file. Neil at the Kent County Health Department will send your program's data contact a secure OneDrive link by email, where you'll upload these CSV files. That's usually done on the 6th. As a reminder, he sends you that. Then the Health Department houses the data, they de-identify it, and then they share it with First Steps Kent for reporting. So the reporting period runs from the first day to the last day of each month, and the submission deadline is the 15th of the following month. So we're always working behind a month. We use this information to reconcile invoices, to track your performance against your contract goals, monitor service utilization trends, and provide evaluation data to basis. It's important to note that records will not be counted if the child is over the age of 5, not residing in Kent County, or if the data is incomplete or not submitted properly. So this slide shows the full data reporting lifecycle. The monthly submissions that we just went over were really like the raw data feed, I guess, that being your demographics, your services, and your referral files, and how it goes to Kent County Health Department and then to First Steps Kent. So in addition to that, every 3 months, you'll also complete your quarterly report and submittable. This includes your aggregate counts of individuals served, encounters, or screenings for that quarter, plus your program goals, your narrative updates, and your parent satisfaction results. We reconcile with those quarterly reports with our monthly data submissions that we've tracked internally. And if there's a difference that's greater than 10%, we'll reach out to you for review or any reconciliation purposes. So think of it as like the monthly data is the detailed source, and the quarterly reporting is really just the validation and the check-in step, but both are really essential to ensuring accuracy and outcomes. So now that we've walked through how the reporting cycle works, I want to highlight that the updated documents you'll need to really highlight and review the updated documents that you'll need starting this new contract period. Please make sure to review them, which is the file definition document. It's really the rule book outlining the technical and required standards for every submission. Even fields that are not shown in your data profile are required. So the data field document, the data fields definition also provides additional context, such as codes and descriptions for each field, including which ones are required. Together, they tell you how to report kind of correctly, and both are essential for using in conjunction with your data profile. We've made some updates, so some fields are no longer required or collected, have updated some field names, and we've added new codes to some fields. So we know that this transition takes time, so Neil and I will be supporting a phased rollout. Our goal is to have the full adoption by March, 6 months after the contract starts in October. And as a reminder, the agency list is also available to make sure submissions are aligned correctly. All these links and additional resources will be provided to you. And here's how to confirm your data is being submitted correctly. So please review your data profile template that is shared in SharePoint Exhibit C. I've already taken most of the time to pre-fill most of these with the codes in the fields that are specific to your program's uses. Just keep in mind that the data profile only lists the unique fields for each file type, that being services, referral, and demographics. That means you'll still need to do and use the file definition document and the field descriptions alongside your profile to make sure that all required fields are included. What I need from your data team is to confirm which fields and codes your programs will actually use. And if anything is missing, to please just let me know. These fields will be verified during the annual assessment, and they're really what validate metrics like individuals served, encounters, and screenings. So it's important to confirm with me once your review is complete. And to emphasize, the data profile does not list every required field, only the unique ones to each file type. So standard fields such as agency ID and record ID must still be included as outlined in the file definition document and field descriptions. And to wrap up, there are two key materials to communicate what families are consenting to. First, the signed consent language. That is the standard wording provided by First Steps Kent. You'll add it into your intake process, and families can acknowledge it either with a signature or either verbal consent. Second is the privacy practice document. This comes from your agency. It can be a printed handout or an electronic document or a link that you can even share online. This gives families the additional details about how their information is handled within your program, and these together make sure families understand what they're consenting to and how their information is used. Lastly, if you have any questions or need any clarification, to please reach out to me. I'm more than happy to schedule a one-on-one. With that, I'll pass it on to Kiana.
Many of you have already finished or have still been in the waiting process to do your contract metric meetings. These may be familiar to most of you. This is your measurement of how many individuals served or individuals encountered you may have. For our direct services, this is where you set your metrics during the contracting process. And the overall goal is that you are realistic with this. And if things are falling behind, you just have to be able to explain why in your quarterly reports. So this information helps to check if you're meeting your contract metrics. And if you have 10% more or fewer people than you expected, you'll just have to explain that variance. And these targeted numbers are for people served that are set out in the agreement that all providers sign. We also have referral services, and our community partners, which is you all, will provide how many individuals will receive at least one known referral through their enrollment in the program. And this is different than the individuals who are engaged or served. And it's about counting how many people are actually getting a referral to a service for support, and not just those who join or use the program. And to figure this out, you'll look at past years, or you'll meet with a team member from Ready by 5 to see what usually happens, and use that to get a good guess or an estimate of how many individuals will get at least one referral during the contracting period. And then you yourself will keep track of those numbers and include those for referral costs and any extra details that will be collected, like the total number of referrals made, the kinds of referrals and organizations that families are sent to. And this tracking just applies to programs that help with finding services and those that offer specialized family supports. So we do have an example here. It is probably going to be very hard to read, so I will attempt to read it for you. This is a case note for parent A. Oh, it's being real funky. Thank you, Elise. This is case notes for parent A. This is just an example template. On January 7th, met with a parent, completed enrollment and consent document, determined needs with the areas of home visiting, housing, preschool, and food, referral plan developed with parent, provided information on food resources and the main intake line for preschool, collected consent to send information to home visiting program selected by parent, staff sent parent information to home visiting program, set date for weekly in-person meeting. These would be like typical social work notes or notes that you or your staff may take. Next day, parent called to notify staff that preschool was no longer needed, referral plan updated, indirect referral, early childhood education, preschool, and this is a confirmed not complete because they did not need the service. On January 9th, which is the following day, the staff called the parent to provide a follow-up information on available housing. Next day, the parent called with questions on how to complete the housing application and left a voicemail with staff. That same day, the staff called to follow up that food resources had been secured, and they identified that this was an indirect referral, family and caregiver support, food access support, and this is confirmed complete. They also had a question about housing application that was addressed with the parent, and application was submitted by the parent the following day. Next day, January 11th, the home visiting program notified staff that the parent had been enrolled in the program, and this is notated as direct referral, mental and physical health needs, home visiting, and again, confirmed complete. January 12th, the next day, staff followed up to confirm the application to housing had been submitted. The parent report then needed copies of documents to be submitted with the application, offered for a parent to come to office, and the staff would provide copies of all documents needed. The following day, they had a weekly in-person meeting with the parent. Copies were given to the parent and requirements of the application were double-checked, confirmed that all materials were enclosed with the application for housing needs, and there was no follow-up in-person meeting that was scheduled at that time per the parent's scheduled time limit for next week. January 15th, 2 days later, the parent called to follow up on housing applications and confirmed that the application had been submitted. 3 days later, on January 18th, there was a check-in with the parent on the status of the housing application. There were no updates to provide. So this individual is counted as one referral served. So only the individuals with at least one referral with a known end result would be counted. So if an individual enrolls and does not receive a referral, they would not be counted as served. Include individuals here that are receiving successful and unsuccessful referrals. And in your monthly data submission information for a referral file for all confirmed referrals, this includes demographic records at the outset and referral records for January 8th, January 10th, January 11th. And then you would provide no additional information about contacts that should be submitted in your monthly data submission. And if you have questions about this, about what should or should not be submitted, you can reach out to Jasper at any point via email. I'm going to go ahead and pass it over to Kati so she can overview our program expenses.
Thank you. So things to know is your spending period. The contract year period is October 1st, 2025 through September 30, 2026. And services are reimbursed monthly on actual cost up to the total amount awarded for the year. Agencies will begin on the contract start date, October 1st, to ensure you will spend funds as awarded. And the goal is to have you all funds spent while providing a consistent level of services through the term of the contract. Since your contract is for 12 months, we will use the 1/12 monthly to estimate if monthly spending is on track. And the reason we are using this formula is to make sure you are in track on your spending, because if you are consistently spending above this amount monthly, you will probably run out of funds before the end of your contract period. And finally, funds cannot be carried over from one fiscal year to another. So whatever amount you did not spend by the end of the contract will go back to the county pool of funds. So as you budget your funds, please consider the following. Costs included in your budget must be specific to supporting the proposed program. Funding may be used for necessary direct, indirect, and administrative costs that aligns with your scope of work. Cost estimates should be based on the actual time for individuals that is necessary to implement the program. Agencies should be able to provide a calculation for each line item in their budget. And also, agencies will leverage all sources of funding in addition to Ready by 5 MIllage funding. And here's the metric that we use to track expenses that we talked before. which is the annual spend to date divided by total annual projected, and that will give us the percent annual spending to date. So if you are 10% above or below, or you're 112, you will be required to provide a narrative to explain why there is a deviation from the average 112. And again, we use the 112 amount to identify programs that may be under or overspending. I'm going to turn over to Megan to go over communications.
Thanks, Kathy. All right, so for communication standards, we have two logos. The first logo is a dual logo between First Steps and Kent County. And this logo needs to be on anything that is provided by MIllage funding. So any publications, brochures, PowerPoints, social posts, website pages that talk about the program that's funded by Ready by 5 or partially funded by Ready by 5, make sure it has that dual logo on it. And then we also have this additional logo. It's optional, but it's recognizable so people can see that it's a Ready by 5 program and parents can recognize it that way. And then for previously funded partners, the difference is that we're not going to use those shapes anymore. You're able to take those off of your marketing materials if you want. And that's because the Yes Ready by 5 campaign, we spent a lot of money to get that handprint out there. So we're trying to just brand it that way. And then key ways to talk about the MIllage. And I'm going to put a couple of things in the chat, but there are a couple of toolkits for you. But one of them has like how you can talk about the MIllage. We want you to spell out Ready by 5, capital R, capital F when you're talking about the MIllage, things like that. You can do RB5 on internal documents, but don't do it externally. And in this kit, there's also some communications expectations. One more thing to call out is we're not calling the program free. It is free to most parents, but we want to say it's acknowledge the taxpayers. So we can say programs are available thanks to the voter approved MIllage. Okay, and then we had these two websites. So the MIllage portal, it's not, neither of these are in the navigation of our First Steps Kent website, so you might want to bookmark them. But the MIllage portal is first, and it has some things like the communication standards, sign up for the e-news, and some things about training and education, and then all your deadlines. And as we move over to Submittable, we'll change some of that, but for now, that's still a good resource for you. And then the new partner toolkit that I finished this morning has some more things like photos, if you want to use photos that you're welcome to use and how to credit those. If you want to order any bookmarks or postcards, I'm happy to supply you with those to put out at events or however you want to do that. And then also a request for a presentation. So if you want your agency to know what the Ready by 5 MIllage is, if we can come in and do a presentation for your group. And a couple of guides. Oh, and then the next page is, the provider network news that goes out every Wednesday or Thursday with any updates that we have. As you can tell, there's a lot of information here, so we try to put some high-level things that you'll need to know in the weekly communication. And you can sign up for that on the MIllage portal. Let's see who's next.
All right, we have a couple of meetings that occur over the contract period, and many of you have voiced some concerns or some suggestions that we have taken seriously, and we have updated the flow of how our meetings will occur. So we do have quick meetings still, however, we will not be separating those out per contract type. We will have 2 days, they will have the same information. If you cannot attend one day, you may attend the other. And we wanted to do this, one, because we heard your feedback and we want to ensure that we're aligning with you. And we want you to have the opportunity to cross-collaborate with organizations that you may not work with daily. That will be March 24th and then March 25th. The overall goals for quick meetings are to determine collective strategies to improve our reach and programming in a specific and defined way, and then review evaluation results to learn how programming collectively has impact and use that data to improve program delivery. And then we want to build a consensus of standards and definitions for data submissions. So this is a good time to give your feedback about data submission. Next, we have our provider networking breakfast. That will be held on January 14th, 2026 from 9 a.m. to 11 a.m. And this is not for individuals such as yourselves who are on this call. This is for your funded program staff. And the networking goal, as many of you suggested, is to provide a connection time for staff to build relationships and strengthen cross-provider collaboration. This is to align effective navigation methods for families accessing early childhood strategies and sharing best practices for surveying families and gathering input to improve service delivery, and then facilitating some discussion and teamwork to better support the Ready by 5 mission and goals and empower service providers to collaborate and improve health, learning, and well-being outcomes for young children in Kent County. Again, that's January 14th. You will get calendar invites for these, just so you're aware. Next, we have Discover Day, which many of you have also attended. This is for program managers or directors and data managers of programs that are currently funded by Ready by 5, and this will be held May 20th, 2026. And the overall goals for Discover Day are to showcase outcomes for children's health, school readiness, and family well-being across Kent County. These are results from community-based programs that improved early learning, parent support, developmental screening, and navigation services. It also helps to display trends in family engagement, outreach successes, and rising participation in services over time. This will also be a time to provide survey data, which reveals parent experiences if they have unmet needs, and any progress in reducing any material hardships that they may encounter, especially among communities of color. We also illustrate progress and challenges in behavioral health, access to care, and equitable outcomes for Kent County's youngest residents. Again, this is on May 20th, 2026. All right. Some of the updates and changes that we have, we've slowly attempted to communicate to all of you. We do have a new platform that we are rolling out. So Carter indicated earlier that we would still be using EC Impact for a short period of time. We will have about a 1-month overlap with that. Your closing contract periods, if you are currently contracted, that will still be your quarterly report will be completed in EC Impact, and your last invoice will be completed in EC Impact. And then we will transition over to Submittable, which is the new platform that we will have. You will all receive a link at some point as we figure out the bits and pieces of that and get you all logged in. And that will come here over the next few weeks. So just bear with us as we swap platforms. If anyone has done that before, you know how much work it takes to get that done. We also have some updates regarding reprogramming and budget transfers. We will no longer have the ability to do reprogramming or budget transfers. When we provide awards inside of the system for Submittable, that will be the award that stands, and that is the amount of money that you should have for the remainder of the year, with the overall goal that every single one of you will use 100% of your funding, and that is the purpose of those dollars. Budget transfers will also not occur in the system. It will not allow you to go over 100% of a spend line, so you wouldn't need to have a budget transfer. So you would just use whatever is available from your overall budget. Your data portfolios also look a little different. Jasper did a lot of work to clean those up to make them a lot easier to read and a lot more understandable. So you should, during your metrics meeting, have a good overview of what those look like and what is needed from all of those. Again, we've updated our quick meetings, our network provider breakfast, and Discover Day. So those were updated with feedback from you, and we, again, appreciate your feedback, and we want and value your input. So let's go over the next steps. You all are here today to learn how to be a community service partner and what it takes to get there start of October 1. So what you'll need to confirm for the contracting process to fully begin is the contract language, your number served or number of encounters, your budget and staff positions. You'll need to develop a timeline. You'll confirm your required data fields. You'll have program-specific goals. If you have any partnership agreements, subcontracts, or MOUs, you'll provide those. You'll update your cost share responsibilities. You will update your authorized signer forms, and then you will review and sign data agreements or amendments. These are specific to every organization, so some things you may or may not have to do based off of your organization. If you have questions about this, please reach out to a funding administrator, or you can also reach out to myself. We've shared the timeline with most of you. This is not a hard or a soft timeline. It is a general guide for where we're looking to have things be completed by. Again, your contract date will start October 1, so you will need to have your contract signed by October 1. I'm looking at the chat here. Is there a template or form you want us to complete for the staff description? It should be included in your exhibit. If it is not, Jessica, I will fix it. Are there any other questions that we have at this time? We'll leave this up for a little bit so people can see it.
Kiana,
right.
not
Oh,
questions.
sorry, go ahead.
Sorry, not questions. I didn't want to type all this because I'm a run-on sentence. Can we run through very briefly again those budget or the fiscal financial reporting changes, just very high level, as I'm representing them and do not speak that language very well?
Yeah, so we will no longer have reprogramming or budget transfers. I see a similar question inside of the chat here. Line item amendments are not allowable, and that is correct. What you have in your budget will be as it stands. This will be much easier when you're all on the platform to understand, but when you go to submit your reimbursements inside of the platform, it will not allow you to go above the amount that's already identified inside of that line item. So it will draw down from your overall total. So say you got $100. If you try to pull $100 from a line that is $30, it will not allow you to do so. So you would just draw down from your overall total by using the lines that you have available.
Okay. I am going to relay that and cross my fingers that makes sense to them.
And if it doesn't too, just reach out and we're happy to explain multiple times. This will probably end up being, we fully understand that transitioning to a system is clunky and it's going to take a little bit to get used to, especially after everyone has been on EC Impact for years now. And it is not just, it's a system that is not growing with us and it's not making anyone's lives any easier. So the hope is that this new platform does, but we also understand that it's going to be a little bit before it actually does.
Kiana, can you maybe explain the budget line item transfers? Like, a budget is like your best guess of where you're at the time that you submit that. So if we're like underspending in one area and the goal is to 100% spend the total amount we're granted, how are those changes going to be, done in this system?
That's a great question. So the reason that we have your budget templates being completed as an Excel form is because we are individually uploading those alongside the new platform hosts, and they're going to hand build your budgets line by line. Thank you, Chair Green. We appreciate you joining in. It was pretty great to have a Kent County Commissioner on with us today. So when you go into the platform, it will be a lot easier. We will also do a training on what that looks like when it is available. So we will not just throw you to the wolves. We will do a training once that is up and running.
So line item amendments are allowed. We're just not allowed to do them in EC Impact. Is that what you're saying?
You will not be able to do line item amendments like a budget transfer inside of the new platform. EC Impact allowed you to do that, but in our new platform submittable, you will not be able to do that. And that is because it will not allow you to spend above the threshold of what that line item has already specified. So if that line item is $100, you may not spend more than $100 in that line item. The system will physically not allow you.
Jamie Mueller has had her hand up for a while.
Oh, I did not see that. Thank you. Jamie?
Yeah, sorry. I'm just kind of echoing what was just asked by Barbara and Jen. So is there a way like on the back end for us to do line item transfers or amendments, or what we submit initially is what we have to operate with for the entire year? Because I think like what was said is we're making a best guess right now, but things change throughout the year. And if you want us to fully spend, things come up, and that's going to make it extremely difficult to do that unless we have the, capability to potentially move some funds around.
Yeah, I completely understand that. So the overall goal is that you may pull from line items that are specific to what you're doing. The system in general is going to pull from your overall budget. You can specify as like a general pool. Again, this is really hard to explain without having the ability to show you. Or you can pull down from line items specifically. So the system is meant to capture your overall budget to pull from, and your budget is put inside of the system so that you can see what you have available in what areas. Does that make sense?
Not really.
Okay.
I'll be
It is
honest.
going to be very hard to explain.
Maybe it's just me, but I'm just thinking from like from our side of things, like our business office is going to need us to be able to report expenses in correct line item accounts. We can't, charge a marketing charge into an office supply or, whatever it might be. So I guess I'm just confused. And maybe once we're in the new system and we can see it, I guess I just want the reassurance that, yes, we can move funds around as needed if necessary.
So this might be something that we segue into the training prior to getting onto the system as well, to make it a little easier so that people understand and you can see what the system looks like. It is really difficult to explain, even for us as we're figuring out what the system is capable of or what it looks like. So before reimbursements even occur, we will have a training on that, and we will have a visual aid for everyone to see. So no one freak out yet.
Well, I think that what the question is that Jamie posed, that I think we kind of all need answers to as we're doing budget revisions is there, maybe not on the system as it stands, but are we allowed to move things over? Because that's not been clear with what you're saying. Like, maybe not on the system, but if I put a budget revision in, is that where it is, and I cannot move from one line item to the other, is what you're saying?
Yes, you are not able to do a budget transfer.
That's really difficult for nonprofits.
So you will just need to have like your best estimate of what you will have in the system, and it will draw down from your overall total. I understand that it's difficult.
So if something is $10 over that line item, is it just going to say 100% spent out of that line item, and then it will just subtract from the overall amount left over?
It
or
will not allow you to draw over the amount that's in the line item, and it will push you to draw exactly what's in that line item and then choose another line item to draw from. You can specify in comments and notes what needs to be drawn down from as well.
so what is the point of doing line items within this new system?
So that we can see where your expenditures are.
But it's not going to be accurate if we can put it on a different line. That's kind of contradictory.
You all are asking questions that we are working to resolve in real time. So bear with us as we transition.
I think that we will. I mean, I think the biggest concern is you're asking us to do a budget revision right now, and it's how do you do that, knowing that this is what's going to be set in stone in the midst of utter chaos in our government.
Mm-hmm.
Yeah, and I just want to step in here. For a lot of us here, we are representing our agency and our finance team, our finance folks aren't on here. This is really going to rattle them, I believe. And, for us to be able to report to them what this new thing is going to be, it's just I'm not going to have a good answer for my finance team when they say, well, what does that mean? Um, I'm not sure what to say to them. And then that makes me rethink what we added in our budget and how we're going to revise that because now I am kind of freaking out. Sorry, Kiana, I don't mean to, but I kind of am. And I'm sure a lot of us here are because if you're saying we can't adjust, um, I don't know how to do that in my brain and to guesstimate that you know that clearly, I guess. I don't know.
Yeah. And I want to validate too that it is completely appropriate to freak out. When we have new transitions to platforms, it is absolutely okay to not feel comfortable with it and to not be okay with it. And like I said, it will be clunky when we first start out. The system is meant for this kind of work, and it is also something that is malleable, and they are working with us on to try and figure out the pieces of the puzzle to ensure that all of you have the appropriate tools that you need to be successful. So again, just bear with us as we try to figure this process out. We will communicate as we are doing it in real time. Now that we have everyone starting the contracting process, please complete your budget templates as you see fit. They can be broad, they can be narrow. You can specify line items, whatever it is that you need to do to make yourself feel comfortable and make your team feel comfortable. It just needs to fit your total allocation award. If you have questions about it, reach out to any of us.
Can I make a suggestion, Kiana?
Yeah.
Because I don't understand the system yet. This is new for me as well. But what I can see maybe is when you submit your monthly reimbursement, it will be for the total amount, not by line item. And then you will be tracked. One thing that I imagine that you can do is you can do it on your end. Like you have your budget template and monthly do it by line item, but then attach it to the invoice. So you will track it internally. So if you want to do budget transfer on your own, you can do it, and then you will attach that to your invoice. But the invoice will pull you won't see that in submittable. You'll see just the total amount awarded. One thing that I think you can do is just do it on your back end, but not through the platform. Just keep track in Excel where you are spending by line item, and then you will attach that in submittable. And if you want to do a budget transfer, you'll do it using your Express Excel. That could be a solution. Yeah.
And is there a plan to have a financial meeting on this fairly quickly, Kati or Kiana? Like real quickly? Because I think, like Susan said, I don't work in finance. This is not my specialty. And I'm trying to relay messages to our controllers, and this is kind of a mess. I don't even know how to explain it to them.
Yeah, yes, we will have meetings to figure out how to relay this information, but again, we are building it in real time. So we are working as fast as we can to make sure that we get things transitioned appropriately. You also asked what were the advantages of moving to a new system versus continuing in Easy Impact. Easy Impact cannot grow with us. We did not have the capability to have all of our staff on the system. It also was not allowing us to add any more providers to the system. We had reached capacity and we had more providers than ever apply for funding. So Easy Impact would not give us the capability to do that.
Hi, Kiana, it's Jamila. I don't want to beat a dead horse. I know you guys have spent quite a bit of time in investing in this new portal and ensuring that it meets the needs of us as well as you all. I second what a few others have said. I think additional clarity, especially meeting with your finance team, because it sounds like a little bit of what you said compared to what Kadi said differs. And incited quite a bit of fear for us because we plan, we do our best in planning what the year looks like, but it's so many things that are outside of our control. And to be held to that exact penny within the budget line item is very difficult. And so for me, I want to know, is it a policy thing or is it a portal thing? And perhaps that clarity will come with additional finance meetings. I would also encourage just some flexibility with the submission of that final budget, as this information is new to us today and the deadline is within a very short period of time. We just need additional clarity on what that looks like from you all internally about the transfers and moving forward. That would be well appreciated.
Yeah, to clarify, and thank you, Jamila, Kati is absolutely correct. You will put in attachments or you will leave comments with what you're needing specifically inside of the system, but the system will have an overall drawdown of your total. So what Kati and I are saying is the same. It's just how we're explaining things. The platform itself is a limiter, so it does not allow us to do the same things that Easy Impact does. They are very different systems. They are very different platforms. We will have quite a bit of flexibility with what you're needing to submit. It does need to fit your allocation amount, though. That's correct, James.
So I do have kind of maybe a similar question about the reprogramming. So I know for Moms Bloom in the past, that has been really instrumental, that other people were underspending and we were trying to keep up when we first did this all in like 2020, 2021. So I'm curious to learn a little bit more about that decision. Like, is that a policy thing or is that a systems approach as well?
That's actually a system limiter, something that's not built into the platform that they're working on building out for us. And it is about a 6 to 8 month build out time, which would be the end of the contract period for us. So they should have it up and rolling, hopefully by the next contract term, but we have no way to actually reprogram dollars. And we have little to no wiggle room for dollars that we have allocated now.
Okay. And it's great if people are spending it. It's just if there's unspent funds, I want to make sure that programs that again are kind of doing more than they're getting paid for do get that, because that was huge for Moms Bloom a few years ago. So I'm going to make sure that opportunity is available for people and programs when they need it.
Absolutely. And the assurance too that reprogramming has not been available as people continue to spend more and more, and there are less and less dollars available. The majority of you are spending all of your money, which we appreciate. Elise, did you have another question? I just see your hand is up.
I think that's Jamila, Kiana.
Jamila, did you have your hand up still? Or did you have another question? I don't know if it's Elise or Jamila.
Nope, we're all good.
Elise and Jamila.
Kim, did you have a question?
Yeah, so when you're talking broad categories, when we submit our budget, do we do something to the effect of like payroll programming, admin. I'm just trying to clarify.
Yeah, however you need to do that, if you need to set up a meeting with Kati and Lindsay and I too, that could be helpful. Whatever it looks like to help create that, whatever you need to be sure that you're successful.
Okay, thanks.
I know that that will probably be helpful for a lot of people.
Just a suggestion here, and Kiana, thank you. I do realize like we are slamming you with a million questions, and you're stating over and over like your team, you're in the middle of doing this, and we understand how extremely difficult transitioning to a new system can be. That said, might we be able to extend the budget deadline? Given that it's due tomorrow, we're getting this information today. I'm looking at having to get with my finance team, my executive team, huddling about this update. It's going to rattle everybody, and I'm going to do my best to try to explain the gray area here. And so I'm not going to have time to do that in real time and have the budget by tomorrow. If in fact, right, this is how it's going to go down.
Absolutely. And like I said, when we presented that timeline, it is a hard and soft timeline. The only hard deadline that we have is your contracts have to be signed by October 1. Hear me when I say that there are some people who do not get those signed by October 1. They will always be backdated to October 1. So if you sign it the first week of October or the second week of October, it will still be backdated to October 1. So it is a hard and soft deadline. I understand that people will need time. We have tried to be graceful before about giving you the time to get those done. And we also understand that the county limited us on how much time we had to even do that, with waiting to approve it the last week of August and really pushing us to all of September and October to get this done. So we completely understand.
So would we just kind of let our contract administrator know that we need additional time? Is that kind of how?
Yeah, communication is most vital for us. If we know, we can work with you. If we don't know, then we're kind of left in limbo to figure out or chase people down.
Thank you.
Are there any other questions? We figured that that one would be the one that threw people most for a loop. So we fully expected questions.
I was just going to ask, just with all of the fury of questions that have come through regarding this conversation, how quick will this recording come out?
We will have this recording available probably, Megan, by end of day or tomorrow.
Okay, thank you.
I can put it on the MIllage portal after it's done downloading and uploading again.
Is that going to be earlier than Megan, like by early afternoon? Thank you.
Yeah.
Thanks, Megan. I hate to put a hard and dead timeline on you, so.
No, I'm good.
Are there any other questions? I see a few of you have emailed me already, so you can also email me.
I'm queuing one up, but I'm waiting for the full meeting where I include all of my questions.
Tara only has 5 questions right now. By the time I get that email, it will have 7.
It's only 4. I'm hoping to keep it under 10.
And if they're good questions too, it may be something that I share with the overall